Cotard's syndrome. It's such an interesting syndrome, and it's a really good conversation starter at a party. It's also known as a walking corpse syndrome, or if you've even heard of nihilistic syndrome, they're essentially all grouped the same. It's a rare mental illness in which the person is who's affected holds this delusional belief that a part of their body is either missing, dying, dead, or just doesn't exist. It's reported to only have 200 cases worldwide. This condition causes people to become even less social, to a point where they may even stop talking at all. The illusion of self negation prevents the patient from comprehending external truths, resulting in a distorted perception of the outside world. Some even hear voices telling them they are dead or dying, while others just refuse to eat. Suicide attempts are popular among individuals suffering from Cotard delusion. Some see it as a way to demonstrate that they've already died and that they can't die again. While others feel stuck in a body and life they don't recognize, others hope that if they die again, their life will improve. The cause? Well, that's a bit unknown, but we do know that this is a symptom of a more serious medical condition that is affecting the brain, such as dementia, epilepsy, migraines, multiple sclerosis, Parkinson's disease, and also bleeding that may occur outside of the brain as a result of a serious head injury. There may be a way to describe the neurological basis of Cotard's syndrome, and this is known as the theories of facial recognition. So basically, the facial recognition is regulated by the fusiform face region of the brain. So the amygdala is linked to the emotions that arise from the recognition of faces. When you see your face, the fusiform region recognizes it, and the amygdala causes the emotional reaction to seeing it. And this is how you get a sense of self. So, if there is a disconnect between these two brain regions, the patient can see his or her own face, but not feel the feelings that go with it. So, essentially, they would lose their sense of self and believe they don't exist if they don't feel these emotions. If you suspect that you're suffering from Cotard delusion, it's important to keep a diary of your symptoms, record when they arise and how long they last. This knowledge will assist your doctor, and also keep in mind that Cotard delusion occurs in conjunction with other mental disorders. So, how do you even treat this? Well, we first start off with talk therapy, such as cognitive behavioral therapy or psychotherapy. If that doesn't work, we move on to medications, such as antipsychotic, anti anxiety, and antidepressants. That doesn't work, we move on to the last resort, which is electroconvulsive therapy. And it is the last resort because one of the common side effects of it is memory loss and uncertainty. So essentially, ECT are small electrical currents that are sent through the brain, in which alters the chemistry of the brain and can alleviate certain mental health symptoms. Well, thanks for watching. I hope you learned something. And don't forget to check out the other videos I have. I talk about a lot of different interesting diseases, disorders, phobias, and basically, I just talk medicine.